Deodorants versus antiperspirants. What is the difference between the two? Well, deodorants are products that are designed to handle body odor and mask that odor or get rid of it, while antiperspirants are products that are designed to stop sweating or decrease sweating from sweaty areas, specifically the armpits and sometimes other areas of the body, such as the groin area. Antiperspirants are especially important in people who suffer from excessive sweating from those areas, specifically the armpits and the groin area, and sometimes other areas as well. Over-the-counter antiperspirants, and deodorants for that matter, which contain antiperspirants, usually use a variety of aluminum salts. These are very effective in decreasing sweat production and secretion, we believe through some form of clogging of the sweat glands, and those work very well. They can stain clothes at times. There are other ingredients in antiperspirants that are over-the-counter, including some of the natural ingredients. Those don't have a lot of backing scientifically, so let's focus on the aluminum-containing products. Let's talk about hyperhidrosis. Now, hyperhidrosis, or excessive sweating, can be a global problem, meaning head-to-toe problem, and more commonly, it's a problem that affects the armpits, the hands, and other parts of the body, specifically the groin area. My recommendation is if you suffer from hyperhidrosis or excessive sweating, try the over-the-counter varieties. So usually aluminum salt containing antiperspirants, those work very well for many of the cases. Obviously use it on an as-needed basis. Don't use it automatically. I never recommend using any skincare product automatically whenever you're expecting that this excessive sweating is going to be a problem. Whether you're in a social situation or you're going to be making a presentation at work, any one of these scenarios or other scenarios where this could be an embarrassment or could be an impediment, please use the antiperspirants that are over the counter. If you've enjoyed this video so far, hit the like and subscribe button, share this video with the people you love. Please put a comment in the comments section. Now, if your over-the-counter approach to treat hyperhidrosis does not work with the over-the-counter products, then it's time to see the dermatologist. What can the dermatologist do? Well, there's plenty of tools available that are prescription-grade tools that the dermatologist can use. First of all, there are prescription-grade topical antiperspirants, specifically prescription-grade high-concentration aluminum chloride that can decrease the sweating significantly. And then there's topical glycopyrrolate wipes that can also decrease sweating significantly and can be very effective. Topical products can cause irritation, so be mindful of that. In some cases, your dermatologist may prescribe an anti-inflammatory medication, specifically a topical steroid, to deal with the irritant dermatitis that some of these products can cause in anticipation of that irritation. But generally, the direction is to use these products and titrate the use to irritation that they may cause. Other modes of dealing with hyperhidrosis are injection of botulinum toxin. That works really well under the armpits by blocking secretion of acetylcholine, which innervates the sweat glands under the armpits. It works less effectively on the hands, and frankly, injection into the hands is extremely painful and usually requires a nerve block so the patient can tolerate the injection. So it doesn't work very well and it's very painful. But for the armpits, it's actually a very effective solution. And that treatment, the effects of that treatment can actually last for several months, which is very, very helpful. Another solution, in case the others don't work for you, are a technology called ionotophoresis. That is running of a low amplitude current to the sweaty areas, specifically under the armpits by means of pads, or to the hands and the feet in case of hand and foot sweating through a very shallow bath, running the electric current in the bath water. Now, this does not electrocute you in the classic sense of the word, so you don't have to worry about that. Those devices are actually well calibrated, and using them several times a week for about 10 to 15 minutes each time can decrease excessive sweating very effectively in many cases after a few weeks of use. For those that have either very widespread hyperhidrosis or the other solutions did not work, there are systemic anticholinergic medications that can work really well, such as glycopyrrolate and oxybutynin. These can have some side effects that can come along with taking that systemic medication, specifically dryness of the mouth or cotton mouth, constipation, and trouble urinating, and in very high doses, people can actually develop neurological symptoms. So ask your dermatologist about potential side effects. I'm sure they'll counsel you about potential side effects and what to watch out for, but obviously keep that in the back of your mind that these medications orally, while being very effective for excessive and widespread sweating, can have side effects that may not be that enjoyable. So keep that in mind. If you enjoyed this video, share, like, and subscribe. Put a comment in the comments section. Tell me what you think. More great content coming your way right from this channel. Thanks for watching, and God bless.